Today I'm going to explain spinal stenosis. Today's topic, a variety of spinal stenosis treatments. Which one is the best? The spinal stenosis is very familiar. Lots of patients and a variety of spinal stenosis treatment methods from non-surgical treatment to surgery. The surgical type is very diverse. Somewhere said that exercise is enough to cure and someone heard it only possible to cure through high-level surgery. What is spinal stenosis and why does this disease have diversity of treatment? The basic cause is that spinal stenosis has a variety of spectrum. Even spinal stenosis is not a simply static disease, depending on how the stenosis progression of the disease. The types and diversity of diseases are very different. So, in the case of mild spinal stenosis, we commonly speak the signs of stenosis, only exercise and medicine available to take care of it. Usually, this spinal stenosis is a degenerative disease, which means that it can gradually worsen over time. So, mild spinal stenosis or severe spinal stenosis. There are many different types of stenosis, ranging from 1 levels to about 5 level encompassing the entire lower back. Even severe stenosis extends to the thoracic or cervical spine. Symptoms can vary widely. So, if you are searching on the internet, you can find a lot of information about spinal stenosis treatment. You might not know which one is correct. It is not something that you can know through the internet. Consult with a specialist to determine the progress of your disease. Depending on the degree, you need to accurately judge what your treatment is. First of all, we can talk about the treatment method. When we recommend the procedure, it is usually in the early of spinal stenosis. In this case, through treating the inflammation near the nerve, decreases the radiating pain caused by spinal stenosis at the leg. You can enjoy ordinary life even though only a simple procedure is done. Even you get the procedure, not completely cured. But if you think about it, with a simple procedure that takes about 5 to a maximum of 20 minutes, you could comfortably walk for about 1 to 2 years. The therapeutic effect lasts for approximately 1 to 2 years. However, if the spinal stenosis recurrences or the symptom progresses, we need to consider the surgery. These days, some people say that endoscopic procedures can treat spinal stenosis. When the endoscopic is necessary for surgery, so we choose to use the endoscope to widen narrowed nerve pathways. But the category of treatment through an endoscope is restricted a lot. So, in cases of very simple stenosis, endoscopy alone can be used to widen the nerve path. The problem is that in case of severe spinal stenosis or a lot of problems of segments, the spine itself becomes significantly compressed and unstable. So, in such case, if the patient only wants to endoscope, the treatment result will be unstable. The symptom is relapsed not long after. Let's think about why the spinal stenosis occurred. Basically, spinal stenosis occurs when the spine is unstable. Why does the spine become unstable? Because the muscles and ligaments are weak, and in an attempt to protect themselves, the ligaments thicken and the joints become thicker, so the nerve of pathways is narrowed. When we treat, scraping away the narrowed nerve pathways through endoscopic treatment has its significance in itself. As time passes, the nerve pathways continuously narrowed. Because the spine remains in an unstable state, so the nerve pathways become even narrower. Only one level simply treat through endoscopic procedure. We can choose to exercise and take care of ourselves, but in case the spinal stenosis is already progressing or many segments occurred with multiple stenoses, it means the spine is unstable. In these cases, although using endoscopy or a microscope to scrape away and widen the nerve pathways can provide relief, it doesn't guarantee a steady state without stenosis. That's the reason why we are performing the ligament reconstruction. Ligament reconstruction is a treat at the narrowed part of the nerve. It plays the role of holding the spine well so that it can become stronger and more stable. There are 2 things to make a stable our back. The first thing is fixing screws into the spine to immobilize it not to move, and they say you need to screw fixation. That is exactly same story. But if the spine is fixed using a screw, the waist is stiff and hard to move it. So, you want the treatment to make a widened spinal canal without recurrence. But when you hear that after surgery the waist becomes stiff and hard to move, so rather than creating an immobilized stabilized lower back, to make a stable spine in moving conditions, remove the bad ligament that pressed the nerve using new ligaments to reconstruction, and doing treatment to make a widened spinal canal. What we treat at Wooridul Spine Hospital, we remove the damaged ligaments and reconstruct them with new ones. This is the ligament reconstruction.